So I'm going to take what has been so well established now from all of the previous speakers in terms of hemodynamics and waveform analysis and apply it to something that I hope will spur some thoughts on your part if you have already developed a carotid protocol or if you're in the process of refining your carotid protocol. So I have no disclosures relevant to this topic. And at this point, when we look at a duplex ultrasound examination, I've asked many classes over the years, what do we mean duplex? What does duplex mean? And sometimes I get an immediate answer, and sometimes I get a lot of, what does that mean? Two things. It's imaging and Doppler. And while we grade the majority of the lesions that we're going to see with spectral Doppler, that we get an assessment of these things in terms of the flow patterns, with color flow, which has been, again, to reiterate, is a mean velocity, not a peak velocity scale, and power Doppler, which I always insert the word amplitude into so that you remember it is not a velocity scale, but an amplitude scale that is shown for general assessment of the flow patterns. Again, spectral analysis or the velocity scale is where we usually make our diagnosis, but it is very important not to forget the B mode or imaging component of this examination as well. So just to review what the IAC has established in their 2020 standards, again, to go over what is required and where I many times go into a facility and they'll say, well, the IAC doesn't require this. I want to emphasize, I took this directly from their literature, and at a minimum, I've highlighted, because this is the minimal standard for what you need to show when you do a carotid duplex ultrasound study. So long axis grayscale images, so long axis sagittal views documented, at a minimum, at least one in the common carotid, at least one in the carotid bifurcation, at least one in the internal carotid artery in terms of grayscale. Now this is B mode. Take the color off, show what plaque is present or what disease is present. And then a carotid stent, if it's present, to show its all extent of it.